Hello, Brad here from 999 KnowHow. In this video, I will go through some patient assessment strategies. So, let's get started. Emergency situations can vary significantly, from traumatic injuries to acute medical episodes. Recognizing signs and symptoms is essential for determining the right course of action which will meet the needs of your patients. That's why effective patient assessments are so important. A patient assessment typically follows a systemic approach. Scene safety. First, always ensure the environment is safe for you, your colleagues, and the patient. Look for any potential hazards, such as traffic, fire, or any unstable structures. Initial impression. As you approach the patient, quickly assess their condition from a distance. Mentally run through a quick checklist. Is there any catastrophic bleeding? Is the patient breathing? Are they alert? Once you've gathered your initial impression, it's time to conduct a primary survey. Catastrophic hemorrhage. In trauma, life-threatening bleeding can cause a rapid and devastating deterioration. A person can lose their entire blood volume in just a few minutes. Arterial bleeding can drain litres of blood from the body in under 5 minutes, leading to shock and organ failure. Major limb injuries and deep lacerations can cause unconsciousness and death rapidly. That's why a primary survey always starts with assessing for any catastrophic bleeding. If the patient is bleeding heavily, stopping the bleeding takes priority over any further assessments. Look for signs of severe external bleeding from wounds, massive bleeding from blunt trauma such as car accidents or falls from a height, stab wounds causing deep lacerations, bleeding from fractured bones like an open femur fracture, uncontrolled bleeding after childbirth known as postpartum hemorrhage. If you find any catastrophic bleeding, you must apply direct pressure to the wound immediately. Use a tourniquet for severe limb injuries if direct pressure isn't working and the bleeding remains uncontrolled. Pack the wound with a hemostatic gauze if available to promote blood clotting. Elevate the limb if appropriate to help reduce blood flow to the site of the wound. Gain IV access and administer medications if this is within the scope of your practice. Only after controlling life-threatening bleeding should you move on to the rest of the assessment. Airway. Now that any catastrophic bleeding is under control, we check the airway. A clear airway is essential for breathing. Here's what you're looking for. Is the patient able to talk? If so, their airway is likely clear. If they're not talking or struggling to breathe, look for any obstructions or signs of airway compromise, like gurgling or snoring. If the patient's airway is compromised, you can use the following interventions. Perform a head tilt chin lift or jaw thrust to open up the airway. If needed, insert an airway adjunct such as an oral pharyngeal or nasal pharyngeal airway. I will cover techniques for managing airways in more detail in another video. Breathing. Once the airway is clear, move on to breathing. You will need to assess how well the patient is breathing. Check for equal rise and fall of the chest. Look for signs of tachypnea or bradypnea and any use of accessory muscles. Auscultate for breath sounds. Can any abnormal sounds be heard, such as wheezing or bubbles? Feel the chest and listen for airflow from the nose or mouth for 10 seconds if the patient is unconscious. If the patient isn't breathing adequately, administer high-flow oxygen using a non-rebreather mask. If the patient is not breathing at all, start ventilating with a bag valve mask. Next is circulation. Check for a pulse at either the carotid or radial artery. Observe the skin colour, temperature, and capillary refill time. Note any signs of shock, which can include pale, cold, clammy skin and a weak pulse. Now we move on to disability, where we assess the patient's neurological state. This is done quickly by using the AVPU scale. Alert. Is the patient awake and aware? Verbal. Do they respond to verbal commands? Pain. Do they respond only to painful stimuli? Unresponsive. Are they completely unresponsive? Check the patient's pupils as well. Are they equal, round, and reactive to light? Unequal or sluggish pupils can indicate a head injury or stroke. If the patient has an altered level of consciousness, consider causes like hypoxia, head injury, or hypoglycemia. Finally, assess for hidden injuries during exposure. Look for injuries, burns, or rashes that might not be immediately visible. Ensure the patient is kept warm to avoid hypothermia. A thorough examination ensures nothing critical is missed, but always maintain the patient's dignity and privacy when exposing their body. I will be covering trauma assessment techniques in more detail in another video. Now a primary survey has been completed, we can move on to a focused history taking. Using the sample method can help gather essential information quickly and efficiently. SAMPLE is an acronym widely used in emergency care and stands for Signs and Symptoms. What do you observe and what is your patient telling you? Allergies. Does the patient have any known allergies? Medications. What medications is the patient currently taking, including prescription and over-the-counter? Past medical history. Any significant medical issues, recent surgeries or hospitalizations? Last oral intake. What was the patient's last oral intake? This could be food, fluids, or medications. Events leading up to the incident. What happened before calling for help? For a structured approach to assessing a patient's pain, the Socrates method is a useful acronym to use. Socrates stands for Site of the pain. Where is the pain located? Onset. When did the pain start? Was it sudden or gradual? Character. What is the nature of the pain? Is it sharp, dull, throbbing, or burning? Radiation. Does the pain spread to any other areas? Associations. Are there any other symptoms, such as nausea or sweating? Time. Is the pain constant, or does it come and go? Exacerbating or relieving factors. What makes the pain worse or better? Severity. On a scale from 1 to 10, how does the patient rate their pain? Understanding medical terminology is vital for effective communication with the wider healthcare team, especially during handovers of care and for completing accurate patient records. Here are a few terms relating to patient assessments and findings. Auscultation is listening to internal sounds of the body, such as heart, lung, or bowel. Palpation, using touch to detect abnormalities, such as tenderness or swelling. Vital signs, the body's physiological parameters like pulse, blood pressure, respiration rate, and oxygen saturation. Hypoxia, which is low oxygen levels. Bradycardia, which is an abnormally slow heart rate. Tachycardia, which is an abnormally fast heart rate, bradypnea, which is slow breathing, tachypnea, which is fast breathing, hypotension, which is low blood pressure, hypertension, which is high blood pressure, hypothermia, which is low body temperature, and hypothermia, which is a high body temperature. In a cardiac arrest scenario, focus on ensuring the airway is clear and initiating CPR. Use the sample method to gather information quickly, particularly regarding any known heart conditions, medications, or any recent health changes or illnesses. In a scenario with a child who has hives and difficulty breathing, we are focused on the A and B aspect of the primary survey. We are looking for signs of respiratory distress, such as wheezing or stridor. Using sample will help you determine if the patient has any known allergies, what medications they have, such as an adrenaline autoinjector known as an EpiPen. In a scenario where a patient has abdominal pain, we can apply the Socrates method to help us assess their pain. We can ask where the site of the pain is, when did the pain start, was it gradual or sudden, what's the nature of the pain, is it sharp, dull, throbbing or burning, does the pain spread to any other areas, are there any other symptoms, is the pain constant or does it come and go, does anything make the pain worse or better, and the severity of the pain on a scale of 1 to 10. Let's quickly recap the key points covered. Always ensure scene safety before approaching a patient to protect yourself, your colleagues and the patient. Follow the primary survey steps to thoroughly assess the patient's condition, always starting with checking for any catastrophic bleeding. Use the sample method for focus history taking and the Socrates method to help with the assessment of pain. Using correct medical terminology not only improves communication between healthcare professionals, but also helps to reduce any misunderstandings. It also helps ensure accurate documentation is created. Thanks for watching. I hope this video has helped provide insight into patient assessment strategies that you can apply in practice. If you've enjoyed it, please like, subscribe and follow us on social media and support the channel. Do you have any suggestions for any future videos? Let me know with a comment below.